Nasogastric entry is achieved by inserting a tube into the nostril that runs down the esophagus into the stomach. This type of feeding tube is commonly known as an NG tube. Additional forms of tube feeding include orogastric, which is a tube that is inserted through the mouth and runs into the stomach, and a nasointestinal feeding tube, which is a tube inserted through the nose that runs past the stomach and into the intestine. The use of nasogastric, orogastric, and nasointestinal feeding is not intended for long-term placement, due to the risk of the tube becoming misplaced in the stomach or intestine, as well as the risk of it being completely dislodged. A misplaced tube increases the chance of aspiration into the lungs, potentially leading to aspiration pneumonia. Also, dislodgements and displacements may require reinsertion of the tube, causing additional trauma for the patient, as well as missed nutrients during the time that the NG tube is not in place. The nasogastric tube is also less aesthetically appealing, as the tube is visible at all times because of its location on the face. The advantage of NG tube feeding is that it is the least invasive and provides the quickest access for artificial nutrition and hydration. The NG tube can be inserted in any setting by a trained healthcare professional. Patient conditions suitable for NG feeding include unconscious or sedated patients, ventilator-dependent patients, patients at high risk for oral aspiration, patients with acute oral or jaw injuries or surgeries, patients who may have some neuromuscular swallowing disorders, and premature infants. The American Society for Parenteral and Enteral Nutrition, or ASPEN, proposes that all post-surgical patients that are severely malnourished and cannot tolerate oral intake should be considered for enteral tube feeding within 1 to 2 days. NG tube feeding should not be used on patients with severe facial trauma, nasal surgery, any types of esophageal conditions, or bleeding disorders. Prolonged placement of the NG tube may cause a risk of infection, perforation, erosion, or ulceration of the nasal passageway, throat, esophagus, or stomach. The NG tube should be replaced periodically per facility policy, or generally every 1 to 3 weeks as clinically indicated. Because the tube can be easily displaced, proper placement of the end of the tube must be checked before each feeding.